Good morning, YouTube. Um, this is the video that I have been promising everybody. So I think I'm gonna start this out a little lighthearted and then get to the serious stuff. So I think we're gonna start this off with a little game. What most people say it's called Two Truths and a Lie. The first one is personal, and the second one is about the migraines. Um, so let's get started. So the first one is about me. Um, and y'all can leave a comment to what you think, which one is a lie. So here we go. Um, Number one is I have three sisters, but one of the sisters I did not grow up with. The other two I did. The second one is I was born in New York. The third one is I have had two brain surgeries before the age of 50. Now remember that two of those is true. One of those is a lie. So you can write in the comments which one of those you think is a lie. Now, getting on to the migraines, we're still playing. Two of these is true. One of these is a lie. Number one, although men can get diagnosed with migraine disorders, and remember, there are tons of migraine disorders, statistically, or percentage-wise, however you want to look at it, it is most seen in women than in men. Number two, although the American Headache Association, or migraines, however you want to classify that, what might be a trigger for patient A is not necessarily a trigger for patient B. Number three, every headache is a migraine. Listen to that closely. Every single headache is a migraine. All right, not playing a game anymore. To put what we're going to talk about today in perspective, or to give it a little context, I'm going to tell you a very true story about myself. Going way back into 2012, I was sent to MUSC back in Charleston, South Carolina, on their 6th floor at Rutledge Tower. Just to let you know, their 6th floor has always been a neurology department, some type of neurology. There are many types of neurologists, but it has been some form of a neurology department. Now, at the time I went, they were doing Botox, they were doing many different things. At the time I went, they had a team that they, very good team, I might add. Besides the Botox, they had a team that said if they could get you down under 10 types of migraines, they could put you in a little program and they could get you on a therapy medication and get you better than you were feeling. Now, keep this in mind that there are no cures for migraine. If you have migraines, there will never be a cure for migraines. If you're going to an anesthesiologist, if you're going to a neurologist, if you are going to a neurosurgeon, they will all tell you there is not a cure for migraines. Their goal is to get you feeling better than you are feeling right now. But there is not a cure for migraines. So they wanted me to fill out this long sheet, and they told me from the get-go that their sheet, they had narrowed it down to there are 212 types of migraines. That was a shocker for me. And they had proof that they had people that they had gotten down to under 10 types of migraines, and they had programs that were working for them. This was the shocker for me. Once I was done with all of their testing, their program was not going to work for me because they had gotten me down to 47 types of migraines. My only hope from that point forward is to go home and start treating the symptoms. At this point in my journey or juncture or whatever word you want to put to it, was I had to start from the beginning. I had to start from the basics. I had to go back and start from ground zero and go, how am I going to tackle this journey? One of the suggestions that they told me was one, to look at holistic medicine, to slow everything down, not to let a doctor throw everything at me, that I was not going to be able to walk into a doctor's office and go, we're going to do this, that I was going to be able to go back to work tomorrow, throw a bunch of pills at it, to start looking at holistic medicine, because I had way too many types to break everything down. And that's what I am going to do for you. We're going back to the beginning. And that is one reason that I wanted to start this for you. So we're going back to the beginning, and that is why I'm starting with breathing. And I know you're thinking of the basics of, I know how to breathe. I do it every day. It's involuntary. Why are you doing this breathing? There is more to this than you think it is. I am not talking about basic involuntary breathing. I am talking about intentional breathing. Purposeful. That is one word I cannot say for some reason. Purposeful breathing. Doing it intentionally. When you do that, when you do purposeful, see, I told you, purposeful breathing, intentional breathing that actually comes from the diaphragm. And it doesn't matter whether it's nose or mouth, but the inhalation should come from the diaphragm and the exhalation through the nose or the mouth. You would be surprised at how much it can make a difference. It can reduce stress. It can aid in stress-related medical illnesses, anxiety, depression, and substance abuse, help in alleviated, reduce some stressful and PTSD. It can improve immune response in the body. It can mitigate asthma symptoms. It can decrease hypertension, and it can aid in COPD. But you have to look at the bigger picture here and start doing it intentionally, not just every day, oh, I'm breathing. So there are many, many other things and with other types of breathing, and we will get to those, but I am just talking the basics. And right now, I'm just going to get you 4 basic diaphragm breathing tips for beginners, and I'm going to end it with there. So number 1, start slow and work your way up. You want to condition your nervous symptoms as well as your respiratory symptoms. Set a timer if you have to. Take it easy. Don't be hard at yourself. It will get better. If you listen to meditation tapes, you will notice with meditation, people who give you advice while doing your meditation, they will use a 4-4-4 method. On the inhalation, they will breathe in for 4, hold for 4, on exhalation for 4. And they don't want to choppy on the exhalation like Lamaze breathing, like they don't want that on the exhalation. They want a very smooth exhalation, like a string. They'll actually use the word like a string, air, rope, yarn, like a. That's what they're asking for. And they'll actually use 4-4-4. So they'll inhalation for 4, hold for 4, exhalation for 4. You will use somebody in the meditation. You will hear the word inhalation for 4, hold for 4, exhalation for 4. You will actually hear and we will go into the different types of breathing with further tapes. 2, make the breath into your belly. Deep breathing won't make your shoulders or chest move dramatically. And the more you do this, you will learn that your shoulders will not move at all. They may move at first, but the more you do it, you will learn that the only thing that's moving is your chest. In the beginning, you may move your shoulders. I remember when I used to do this at first, my husband would be like, quit moving the bed. But the more I got comfortable with doing it, he didn't even know I was doing it. So practice. Practice makes perfect. A sign that you are diaphragm breathing is that you lower the abdomen, is filling and emptying with air. Make sure your belly, and this is the difference between yoga breathing and meditational breathing. And it's kind of like backwards breathing, and that is something that we will get into later, the difference between yoga breathing and meditational breathing. But make sure you are taking a full breath and exhalation, blowing it all the way out. When you are breathing, and that's also good for your respiratory system. It helps your lungs too. Please keep in mind also, make sure expand. It's good for your respiratory. It's good for your central nervous system. And that's number 2. Number 3, you can't go wrong either way at this basic level. Breath work floods your brain with oxygen. The more oxygen you get into your brain, it removes amount of carbon dioxide, and that's what you're trying to do here. Different types of breathing we will cover with the meditation, but that's what we're trying to do here. Get in more oxygen, remove the carbon dioxide here. And that's something, like I said, that you cannot go wrong. 4, find a breathwork practice that resonates or works for you. All of these techniques that will achieve with proper breath work starts at these basic levels. We will cover other breath works as we move forward. And what I mean by that, there is stuff like hyper breathing that we can do that I am trained to do. We will cover that. Divers use it, Navy personnel use it. It is actually good for your lungs. Meditational breath work, yoga breath work, there's different kinds. We will go through that. It's good for migraine patients as well. But you have to start with the basics. You can actually slow your breathing down. I can slow my breathing down at night where I am only breathing 4 to 6 breaths a minute. I can hyper breathe myself where I am breathing much more. You can hold your breath. And that is actually good, but you don't need to do it to the point where you pass out. It is all about finding out what works for you. These tips are all a good starting point for you, but you have to learn the basics first. I know this was a long video. Leave me a comment. Let me know what you think. Also, let me know what you want to hear, whether it's for migraines, not for migraines. I'll be more than happy to do the research and let me know what you want to hear. I'll look it up and do a video for you. I have no problem with that. So, thumbs up, thumbs down, subscribe. I also left 2 posts on there. YouTube has posts. Let me know what you think of the post. And I'm here for you. I'll talk back to you. You guys have a great morning. Talk to you soon.